Hey y'all, I'm putting together this video series because my dad, every single time I ask or talk to him about what I do at work for my PhD, he is always like, I don't understand. So I figured I'd put together a video series of what my day to day is like and what the different places I work and what I do at each of those places. So today is day one, Monday. Today I'm seeing a patient in the neuropsychology clinic at UHN or Toronto Western Hospital. Here right now I'm working in the epilepsy department. There's a kind of two parts to the clinic. One's epilepsy, one's Parkinson's disease. So one of the treatments that after you've been on medication for a while for Parkinson's disease, people can get deep brain stimulation, and part of the assessment, which is what I do, before they have the treatment, is to make sure that it is safe for them to have deep brain stimulation if you have Parkinson's disease. And so we do a variety of different cognitive and psychological assessments to make sure that if we were to put an electrode right into the middle of the brain, it wouldn't cause further damage. So that's on the Parkinson's side. And now, as I said, I'm on the epilepsy side right now. And for this side, I do, again, more a neuropsychological assessment, so cognitive and psychological. And on this wing, patients who've had epilepsy for a while and tried a variety of different medications for epilepsy, and it seems like their seizures aren't being able to be managed just with the medication. One of the things they can do for that is to have surgery. And so that would be for people who have seizures due to focal issues. So let's say all of their seizures are coming from like their temporal lobe right here, then they can take out the temporal lobe, or they can take out the frontal lobe, or they can put a lesion in those areas to stop the seizures. Now, what I do is basically to see what they would be like if we were to take out that region. Is it safe for us to take out that region? So the first patient, I saw today, we took them to an fMRI, and so the first thing we do is to see where their language is lateralized. So we do a functional scan, and while they do a language task and see if their language is on the left area, on the right area side of the brain. Most right-handed people are left lateralized, but with epilepsy, it's oftentimes that can be switched or be bilateral. Their organization changes for language. So that's the first thing, because we want to know where the language area is, because we don't want to be taking that out. We don't want to, this is a voluntary surgery. We don't want them coming out worse than they went in. Imagine you went in for surgery and then you came out and you couldn't speak. That would be terrible. So there's that. And then secondly, we do a variety of tests with them, so memory tests, attention tests, and I spend the whole day with them. It takes about 5 hours from start to finish, and we do all different types of testing, and depending on where their seizures are coming from, the amount of testing or the type of testing we do is different. So if their seizures are coming from their temporal lobes, then we do much more memory tests, because that's where memory is located. That's where your hippocampus is located. Those initial short-term memories. If their seizures are coming from their frontal lobe, then we do tests that look at executive functioning, planning, things like that. And so basically it's to see whether the function of that area is damaged, and not just that, but then it's also the complementary side is preserved. So for example, if someone was having left temporal lobe seizures, then we would want to make sure that the right temporal lobe was functioning good, and so that if we would take out the left, then they had enough reserve in their right memory functioning, so that they can proceed in everyday life. Like if the right was terrible and we took out the left, then that would be not a great situation. So that's kind of some of the things we do here. And typically on a day like today, I'll see a patient all day. But then there's other times where I'll come in and we'll do rounds, and then I'll write reports. So reports also take a while. So there's seeing the patient, then there's scoring all the results, from the analysis, and that takes typically a couple hours, and then writing the report, which also takes a couple hours. So all in all, seeing one patient for a full day, it's a full 2 days of work. Cool. Okay, till next time.